Hello, everyone. Thank you for joining us today. My name is Derek Hunter from CMS's Division of Value-Based Incentives and Quality Reporting, and I will be moderating today's forum. This bi-monthly forum aims to provide national stakeholder organizations, specialty societies, health IT organizations, and EHR vendors with information relevant to CMS's Quality Measurement and Value-Based Incentives Group. Next slide, please. Our program today will include updates on the Medicare Promoting Interoperability Program, the ECQI Resource Center, a Clinical Quality Language Libraries webinar, eCOM flows and the annual change review process, Quality Payment Program, and alternative models. We will have a question and answer portion once all presentations are concluded. Please note, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio pin entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone. And now I will turn it over to Jess Warren. Jess.
Thanks so much, Derek, and good afternoon, everybody. This is Jessica Warren from the Medicare Promoting Interoperability Program. Next slide, please. Just a few updates and reminders for the Hospital Promoting Interoperability Program. First, the EHR reporting period for 2021 is a minimum of any continuous 90-day period, with October 3rd being the final day to begin those 90 days. In addition, eligible hospitals and CAUs must have certified EHR technology in place by the first day of the EHR reporting period of their choosing, and that must continue to be certified through the last of the 90 days in that reporting period. Based on 2021 requirements, eligible hospitals and CAUs may use existing 2015 edition certification criteria, 2015 edition CURE's updated criteria, or a combination of the two technologies. Last, in order to avoid a downward payment adjustment, eligible hospitals and CAUs must successfully attest to all of the PI program requirements. We have a few links listed here for additional information. Next slide, please. Noting that we released the FY 2022 IPPS final rule on August 2nd of this year, in addition to the webinar that we have planned for later in calendar year 2022, we also have links on the slide for additional information, including links to the final rule. Next up, we have Vidya Sullivan, and she will be presenting on Electronic Clinical Quality Improvement Resource Center updates. Vidya?
Thanks, Jess. So Joe, Mister, and I are going to share just a few updates that we have to the ECQI Resource Center. Next slide, please. So before Joe shares the updates, I just wanted to give everybody a quick reminder of the ECQI Resource Center. It's the Electronic Clinical Quality Improvement Resource Center, and it's a website that provides a centralized one-stop shop for stakeholders who are engaged in electronic clinical quality improvement. CMS and the ECQI Resource Center team provide a user-friendly website with the most up-to-date information pertaining to technical requirements of electronic clinical quality measures, or eCOMs, in CMS quality programs. It provides information for eligible professionals and clinicians, as well as hospitals and critical access hospitals. It includes standards information. It also includes tools, resources, and educational materials. Next slide, please. Now I'm going to turn it over to Joe.
Hi, all. This is a screenshot of the just released updates for the homepage for the ECQI healthit.gov website. Here you're going to find some new features that we just released. First off, here in the blue banner area, we have a new news and events area where you're going to be able to find the most up-to-date and recent items that are coming out and available for you to interact with. And then in order to make life easier and streamline search efforts, we've added a new search to the homepage here where you can type into the Find an eCQM input there, and it will live search based off the CMS ID or the title combination, and allow you to select a performance period and then either navigate directly to one individual measure or see a list of things. So if you were to type in adult and wanted to see everything related to adult in 2020, you could do that and get a little table down below, and then click to your page and get all the information you need. And finally here, the final update on the homepage are the featured resources here. We have some new icons and graphics being presented here from the team, as well as some subtext and headlines. So overall, hoping that this will improve the search functionality on the website, and look forward to continuing to improve that for you all. Next slide. We encourage you to visit and provide us with feedback by visiting this website and then shooting us an email, and look forward to hearing from you and getting your input. Next slide.
Thanks, Joe. This is Jen Seaman. Oh, sorry. Go ahead.
Sorry, Jennifer.
I'll proceed. All right. So next slide, please. I'm Jen Seaman from ESAC, and we wanted to make you all aware of a special session that CMS will be hosting of the Cooking with CQL series. We want to use this session on October 28th of this year to gain feedback on the concept of sharing CQL libraries used across eCQMs in QDM-based measures. One of the things that we want to do is go through use cases and find out how implementers are using CQL definitions from measures, and we are particularly interested in getting feedback from individuals who have a good understanding of the implementations in your systems. If you utilize those CQL definitions outside of eCQMs at all, we're very interested in that feedback. The link is provided here to download that event to your calendar, and you can submit at any time CQL-related questions or suggested examples for that session or any other session to CQL-ESAC@esac8.com. And if you have any other questions about the webinar specifically, you can email the ECQI Resource Center team at ecqi-resource-center@hhs.gov. Sorry about that. Thank you. That's just our announcement, and I will pass it to Claudia.
Thanks, Jen. This is Claudia Hall from Mathematica. Today I'm going to be talking about two topics that are eCQM related, one being the eCQM flows and the second being the eCQM change review process that happens as part of the annual update. All right, so we'll go ahead and start with the eCQM flows. Next slide. The eCQM flows are published on the eCQI Resource Center, so that was just demoed a few slides ago, and they are published in late summer after the annual update publication, which usually happens in the early summer. The flow diagrams present a visual depiction of the measure's population criteria and really are there to help implementers see the to highlight relevant data criteria, organize the specifications to help interpret the logic, and understand how performance rates are calculated. And again, these can be found on the eCQI Resource Center. Next slide. So when we go to the eCQI Resource Center, under the eCQM tab, there you see the EPEC eCQMs and then the EHCH eCQMs. And if you click on those links, it will take you to the Resources tab. So if you go to the next slide, please. In that eCQM Resources tab, there are several different types of annual update publication artifacts, and one of them, which again is published a little bit later in the summer, is the eCQM flow zip files. And you can see the arrow pointing to the link there. Next slide. So on this slide, we have an example of an eCQM flow from the eligible hospital, critical access hospital flows. These are arranged in a swim lane diagram format. So on the left, you'll see that we pull out pertinent data elements from the measure and organize the logic flow. And then it also contains a narrative section at the end, which helps identify the different population criteria. Next slide. And this is an example of an eligible clinician, eligible hospital flow. It's got a slightly different look, but it does the same thing. It organizes the content to call out the pertinent data elements on the left-hand side, and as well as showing the data flow and how the measure is calculated. And then on the right-hand side is an example of the narrative section of that flow. Next slide. And again, these can be found on the ECQI Resource Center. And these are really a nice handy tool to use as you're looking at a measure and implementing it into a system. Next slide. Okay, next we'll talk about the change review process. So CMS continually seeks feedback from stakeholders on its programs and their implementation. And as part of the eCQM annual update, CRP is there to provide eCQM users the opportunity to review and comment on draft changes to the specs that are under consideration by the measure steward. The goal of the CRP is for implementers to comment on the potential impact of draft changes, so CMS and measure stewards can make improvements to meet CMS's intent of minimizing provider and vendor burden in the collection, capture, calculation, and reporting of eCQMs. And the types of changes that are seen in CRP can be either technical or clinical, or even sometimes for informational. The CRP uses the ONC project tracking system, JIRA, the eCQM issue tracker, to post CRP issues for public review and comment. Next slide. So let's take a look at CRP and how it fits into the eCQM annual update process. So CMS publishes eCQMs each year following an annual update process. At the beginning of the process, measure developers, they respond to feedback via JIRA tickets. They identify changes and clinical updates for eCQMs. And usually that happens in the summer, late fall. And then measure developers present changes to CRP for public comment. And that is currently what has started as of September 8th. And CRP is an integral part of the eCQM annual update process because measure developers and CMS review and vet CRP recommendations made by the public and take those recommendations to implement during the annual update process. Then the measure developers implement those changes, and then of course, with the last step being that the measure specifications are published. Next slide. Here's a quick preview of the CRP posting and comment process. So measure developers identify an issue or potential change and create a JIRA CQM ticket that's flagged with a CRP label. Interested parties review the CRP issues posted to the JIRA tickets and provide feedback through comments. Each cycle of CRP is 2 weeks and is so that cycle will be open for 2 weeks for a total of 4 cycles. And once public comment is received, the JIRA ticket may be updated and closed, or maybe put out further for another cycle to gain more feedback. And then once the cycle is completed, measure developers and CMS review the comments and feedback and determine the final changes to be made for that eCQM annual update. And then at a later date, the JIRA ticket is updated with the CRP outcome. And the ticket is closed after the change is implemented in the annual update. Next slide. So who can participate in the CRP? CRP participation is open to all ONC project tracking system JIRA eCQM issue tracker project users, which includes CMS, ONC, measure developers, eligible clinicians, eligible hospitals, EHR vendors, vendors of certified technology, and any other interested implementers. Next slide. So where can you find CRP issues? Again, they're posted to the eCQM issue tracker project on the ONC JIRA, and they will have a special label like that's flagged in this slide, labeled CRP. Additionally, there is a summary page that will list all the open CRP tickets for that cycle. Next slide. So how can you be notified of CRP issues? The best way is to sign up for the weekly CRP digest, and that is a weekly digest email that includes a summary of all the issues available for public comment. The emails will provide information about each change, including the eCQM CMS number, the JIRA ticket number with a link, measure title, type of feedback, and the public comment open and closing dates. To subscribe to this email, please email crp@mathematica-mpr.com to be added to the list. And again, the announcements and issues are all located on the eCQM issue tracker summary page as well. And the announcement to CRP is also available on the eCQI Resource Center. Next slide. So how can someone participate in CRP? First, you'll need to sign in using your ONC Project JIRA account. If you're a new user, you can create an account, and then view the list of open tickets to the eCQM issue tracker summary page, and then sign up for the digest email and take a look at all the JIRA CQM tickets that have a CRP label. Once the issue has been reviewed and any additional materials are also reviewed, tickets are open for public comment, and you can easily comment by clicking the comment button at the top of the ticket and typing it in there. Next slide. And here it lists CRP resources. There is a link here to the eCQM JIRA issue tracker, and then of course to the eCQI Resource Center, which is the one-stop shop for the most current resources to support electronic clinical quality improvement. And that concludes this section. Any questions? Any questions about CRP can be submitted to the email address on the slide. Thank you.
Next, we have a presentation from Katie Moore.
Great, thanks, Derek. Good afternoon, everybody. So we have a number of things going on in the quality payment program. So we'll try and go through these slides as quickly as we can and leave room at the end for questions. Next slide, please, Joy. Okay, first update is to let you all know, and this is a heads up happening on Friday. I don't know where September went, but apparently Friday is October 1st. But that is the date that the virtual group election period for the 2022 performance year opens. So this is for folks that want to participate as a virtual group during next year's performance period. And if you have no idea what a virtual group is, that is okay. We have a a really handy virtual groups toolkit on the QPP resource library. I don't believe the 2022 version is up just yet, but it should be by the end of next week or definitely by early next week if it's not up this week. That explains exactly what a virtual group is, number of things you want to take into consideration when you're thinking about participating that way in QPP next year, and a quick high-level description of a virtual group. Its name is exactly what it is. It is, and it's a really neat option that is available to small practices. So clinicians that participate in a group that's 15 or fewer clinicians, they can group together with different small practices to form a larger group. And there's a number of benefits to participating this way. And we list out in our toolkit all the different requirements and things that need to be met to participate as a virtual group. So encourage you all, if that's something you're interested in, to check that out. And if you've known about virtual groups and if you participated in a virtual group in 2021, so this current performance year that we're in, just want to flag that if you would like to continue participating that way in 2022, that is great, but you still required to submit an election to CMS through this process. So it opens this Friday, and there's in the toolkit it lists out everything you need to do. But to receive approval to participate this way, you need to fill out an election and send it to the email that's listed on this slide by the end of this year, so by December 31st at midnight. So you have a good length of time to submit that information, and all of those details are included in our resources. Next slide, please. Okay, great, thanks. So this is just some information about changes that recently happened that impact our MIPS facility-based scoring. So in response to COVID-19 public health emergency that is still ongoing, CMS finalized through the IPPS rule recently that a measure suppression policy for several of our hospital reporting programs, including the hospital value-based purchasing program. And this impacts our MIPS participants that use this score because calculating a total performance score in the hospital VBP program for hospitals using only data from the remaining measures wouldn't result in a fair national comparison. So CMS finalized a special scoring policy for 2022 that won't calculate this total performance score for any hospital for 2022. And so if a facility-based clinician in MIPS or group doesn't meet the case minimum for any of the cost measures, that cost performance category will be reweighted to 0%, and the weight will be redistributed to other performance categories. And also noted on the slide, facility-based clinicians and groups without available and applicable measures. We also have our EUC, so Extreme and Uncontrollable Circumstances application available. So based on there not being an HVBP score available to you because of COVID, you definitely have that application open right now through the end of this year. And I'll talk more about EUC in a couple slides. But that is available if you need to submit an application to request reweighting for any of your performance categories for 2021. Next slide, please. So hot off the presses, this announcement just went out yesterday. So this event is very well timed, and you guys are the first folks that we're talking about this announcement to. So a listserv went out yesterday that we sent out a message in August giving folks a heads up that we had identified a couple of issues, and we're trying to work through how to fix those issues that we identified, and then update final scores. So a message went out yesterday afternoon, later in the day, on the QPP listserv that gave a lot more detail. So we identified 2 issues, and these came about during our targeted review process, which I'll talk about on the next slide. So this process did exactly what it's intended to do. It's to let us know about any kind of scoring issues that that we needed to correct, so that people have the most accurate final scores and correct payment adjustments, which is the most important part there. So we did identify 2 issues that were corrected in our MIPS scoring logic. This resulted in changes to performance feedback, including our final scores. And the 2 issues, so the first one is related to our complex patient bonus, and this mainly impacted our shared savings program, ACOs, and it just, we wanted to make sure all of the ACOs got those points that they deserved. And the scoring logic in our system left out those bonus points. So we made sure those got added back in. And then the second one was the patient-reported outcome measure correction. And this was another system issue that it didn't recognize patient-reported outcome measures as outcome measures. So again, folks just weren't getting all of the points that they should have been getting. So those were identified through our target review process. And then we did some more analysis to figure out the impact of those issues and then to correct them. So, and in correcting those scores, we updated them yesterday, so everybody's final scores are accurate right now. And then we also, because of this, we had to rerun payment adjustments since our program is required to be budget neutral. And so additional updates were made to payment adjustments. So all of that information was updated in our in folks' feedback yesterday. So that is available now. Next slide, please. Great. So as I mentioned, the target review, this is a process where if you participated in MIPS in 2020 and you're looking at your feedback and your payment adjustment and it doesn't look right to you, or think the calculation of your payment adjustment isn't correct, you have this opportunity to submit a request for CMS to take another look at your scores and your payment adjustments to make sure you got all the points you were supposed to get and everything was done correctly. So since we updated scores yesterday, we also extended that target review window. So we're giving folks an additional 60 days. It's actually a little bit more than 60 because the 60 days ended right around Thanksgiving. So we are giving folks until November 29th. It's a Monday, Monday after Thanksgiving, to submit a target review request to CMS. And there is additional information in our target review user guide. So encourage folks, if you believe you need to submit a target review, to check out that resource, and it'll give you step-by-step instructions on what information you need to provide and how to access the target review form and where to go. Next slide, please. So yesterday's message about final scores update also had a second message with that listserv. So another announcement that happened just yesterday related to 2020 performance year. So this is last year's performance. So in response to our COVID-19 flexibilities, we are allowing clinicians, groups, virtual groups, APM entities to request MIPS performance category reweighting for 2020 under our EUC policy, so that extreme and uncontrollable circumstances policy. And this is where this is not related to our audit policy. It is where clinicians that were impacted and didn't have a chance to submit during the 2020 application period that I believe ended March 31st of 2021. We're giving the second opportunity for clinicians that need to submit an EUC application to us. The important thing to note here that's different is that, so we talked about the current EUC application system that is open right now. We have technical limitations, and the system itself cannot have two performance years cannot support two performance years at one time. So we still wanted to give clinicians this extra opportunity to apply for these flexibilities if they needed to. And so and this is again related to the 2020 performance, you would need to submit this exception reweighting request through our target review form. So that same form we just talked about on the previous slide, we've updated that form to include a section where you can submit an EUC reweighting request through that same form. And sorry, there's a typo on this slide, I believe. The form's open until the 29th. So we'll get that fixed. But so you have until that same date, so until that Monday, November 29th, when that form closes, to request reweighting. And again, there's since we know this is a brand new way or a different way for 2020 to be submitting this request, we do have up on our QPP resource library, we have the listserv announcement. We posted that to a resource library because we knew it had a lot of important information about scoring updates and then this EUC announcement. So the listserv is available, as well as a step-by-step guide on how to use the target review form to submit a reweighting request for 2020. So those are both available on the QPP resource library. Next slide, please. Okay, and this is related again to our EUC policy. This is slightly different, and this is related to 2021 performance year. This is our automatic EUC policy. So right now, so this is for clinicians, they don't have, and this is for individual clinicians that are in these FEMA identified areas of Louisiana, Mississippi, New York, New Jersey, and Missouri. They automatically be identified and receive, have all of their performance categories reweighted for 2021, which relates to a neutral payment adjustment for the 2023 MIPS payment year. Because we know, because of a lot of different disasters that have happened recently in those areas, that the majority of clinicians are not able to participate in the program. And we have this policy that is a great flexibility we're able to provide to clinicians, especially when they're in these certain situations like these disaster areas. So for right now, for 2021, these are the only areas that the auto policy will be applied. I know we've gotten a number of questions if the COVID-19 flexibilities that we have issued over the past couple of years related to the auto policy, if we'll be extending them for 2021. And I just wanted to let folks know that we have not made a decision on that yet. So currently, these are the areas that are going to have the auto EUC policy applied. But this is a good opportunity to say, if you are not signed up for the QPP listserv, I encourage folks to get signed up for that. If you go to our website, qpp.cms.gov, at the bottom of, it might be at the bottom of every page, but I know it's at the bottom of the first page, there's a spot to put in your email address. And that is our main mechanism for getting out these alerts and updates as soon as we're able to share additional information. So I encourage you to sign up if you haven't already, so that you are aware if any changes happen. Okay, next slide, please. Okay, and just reiterating, Jessica said it at the start of the presentation, for promoting interoperability, but October 3rd, which is coming right up at the end of this week, beginning of next week, I guess, 90-day performance period deadline. So this is the last day to start that 90-day performance period for promoting interoperability and improvement activities performance categories. So not all of our improvement activities have a continuous 90-day performance period, but several of them do or have longer. So just encourage folks to check out the deadline for if certain improvement activities that you've chosen, as well as all of the different promoting interoperability. Next slide, please. And again, this is just more information on promoting promoting interoperability requirements for that performance category under MIPS. This just lists out a lot of the different details, but the easiest resource is listed here at the bottom. So if you go to our 2021 Promoting Interoperability Quick Start Guide or a more detailed user guide, they're both on our resource library. So encourage folks to check out from those resources for more information, as that deadline to start collecting data is coming up very soon. Next slide. And again, same information here. We just have similar quick start guide and user guide for improvement activities. And this slide just lists out the the requirements for this performance category. So you need to submit one of the following combinations of activities. So you're required to have 2 high-weighted or 1 high-weighted, 2 medium, or 4 medium-weighted activities. So most of them have that 90-day performance period, but just wanted to flag that some of them do not. So be mindful of that. Next slide, please. Okay, and this just lists out some upcoming, actually I guess we don't have any upcoming webinars, but just some resources. I know I flagged a few throughout the presentation, and the ones that we just released yesterday related to the scoring update and EUC application reopening for 2020. But here are some other ones that we've recently posted. So 2021, the traditional MIPS scoring guide, our 2021 group participation guide, and then our 2021 MIPS auto EUC policy fact sheet that we've updated. And that resource will continuously update that throughout the year as different areas of the country get added to that, or as things change with our auto policy designation. Next slide. I think that was it. Okay, I'm going to hand it over to Dr. Corey Henderson to talk about alternative payment models.
Thank you, Katie. Good afternoon, everyone. Next slide, please. Have you heard of the APM incentive payment? Well, if you haven't, we've made an announcement. Back on June 25th, we announced the alternative payment model incentive payment details on the QPP website. Now, that allows for you to understand where the 5% APM incentive payment lives or is, or has it been mailed out, or has it been paid? The reason why we mention it this way is because we need you, those listening, to let someone know, hey, did you check and see if you got your 5% APM incentive payment earlier this summer? If they didn't, then they can log into the QPP website using their HARP credentials and find out whether they received their APM incentive payment or if they're due an APM incentive payment. Many QPs that were in organizations may not be aware, and it's usually the surrogate or someone in the organization that looks that information up. In doing so, we then decided to release a list of names on a public notice that helps you verify your Medicare billing information by November 1st. So if you find your name listed either on the website and you don't see a payment, then you can then go to the APM incentive payment public notice, and you'll discover a list of names that should have been paid. These list of names will show that we don't have to correct billing information for you. So because it could have been maybe you just didn't update it in PAYCOs, or we just had a cross of misinformation there, we need to have the correct Medicare billing information. So you can send this back to us by November the 1st, 2021. We've issued several updates around letting people know that we want to make sure everyone gets the 5% APM incentive payment that they earned in 2020 based on the performance year of 2019. So if you're interested in learning more about the APM incentive payment, come to our webinar, September 30th, 2021, from 2 to 3 p.m. Eastern Time, and the information in the link is listed below. Next slide, please. Now, in addition to the APM incentive payment, QPP has also issued several information in our final rule last year around the APM performance pathway. We've moved away from some of the APM scoring standard that we had and now issued a new way that clinicians can submit if they are in an APM entity. And in doing so, these clinicians and their organizations are going to be participating in MIPS if they're in a MIPS APM. So to learn more about that, go to our QPP resources and you'll discover a APP toolkit for 2021 performance year. This includes a quick start guide, fact sheet, infographic, user guide, and reporting scenarios. And so you don't have to search all over the place. It's all in one downloadable zip. There's also information on our webpage under the MIPS section around the APP, and that will help you understand scoring, submission, and quality measures. We also hosted a webinar back on September 27th, just on Monday, that provided an overview of APP-related policies for QPP. So the webinar's recording and slides will be posted shortly, and when it is posted, it will be on the QPP webinar library in the coming weeks. Next slide, please. And last but not least, most importantly, as you are participating this year, you want to let your clinicians know, your organization know, or you want to be aware that in October, CMS will update its QPP or Quality Payment Program Participation Status Tool, where you learn about where am I, what have I done this year, what data has QPP collected or CMS collected that shows my level of participation. If you're in an advanced APM or a MIPS APM, you want to know, hey, what's going on with my second snapshot data? So that information will provide you with an understanding of what we know about your participation in your advanced APM and whether or not we see you on a participation list for January 1st, 2021 through June 30th, 2021. The tool also includes your QP status up to this current date and MIPS APM participation status. And to learn more, as not only we will provide that information, as Katie said, by signing up for our QPP listserv, but you'll also be able to learn about that by going to our Advanced APM's webpage on qpp.cms.gov, or you'll also be able to discover that just by logging in to our system by looking up your data, you'll see that we've updated the tool. That's coming in October, and we look forward to sharing more information with you. Thank you. Next slide, please. And you can take it from here.
Thank you to all of today's presenters. We will now move on to the question and answer portion of the webinar.
As a reminder, to ask a question, you can either submit your question using the chat feature or raise your hand and CMS will unmute your line. For those dialed in via phone, you must have your audio PIN entered. If you're listening through your computer speakers and want to ask a question, you must have a working microphone.
Okay, our first question is for Claudia. Claudia, when you were speaking, you mentioned that measure stewards decide whether or not to open an issue and that we commenters can respond. Are commenters allowed to open issues or must they only react to them?
Hi, thank you for the question. So the eCQM JIRA tracker can be used by anyone that has access to open questions about any CMS program eCQMs. The CRP process specifically, in where those JIRA tickets are flagged for CRP, are posting specific questions put to the public that where the comments should be designated for those specific questions. But if there are additional questions, again, you can use open up a JIRA ticket using the eCQM JIRA tracker. And we do welcome feedback throughout the year for that.
Okay, thanks, Claudia. Katie, our next question is, are federal qualified health centers still exempt from participating in MIPS?
Yes, I believe they've always been exempt, but that hasn't changed.
Okay, and then Katie, our next question is also, and this may also apply to Corey as well. I'll let you both, either one of you want to weigh in. If a MIPS PIN is part of an APM group for 2020 and they applied and were approved for the 2020 EUC, but already had the APM group score, would their EUC now impact the APM group score for 2020, or is it a simple exclusion with no downside impact to the group score?
It is my understanding that that is an exclusion. The EUC trumps all of that, and that's part of our announcement of just making sure that we didn't add any additional burden. So if you were qualified through the EUC for that exemption, then that won't have any bearing on anything else.
Okay, thank you. What is the start date? I believe this also is for Claudia. What is the start date of the fourth and last CRP cycle? Assuming if eCQM's concern is proposed by that cycle, it will not be reviewed until the following year.
Hi, this is Claudia. I am going to look at that. The start date for the final CRP cycle is Wednesday 10/20, and then the public comment period closes November 3rd. So that is the last cycle. Depending on the type of issue proposed, it is possible that items coming forth after that time period would be moved to the next annual update cycle, and that is depending on CMS's discretion. Thank you.
Okay. Joy, do we have any questions on the phone line?
Yes, it looks like we have one question. Kathleen Riley, your line has been unmuted and you can ask your question. And it looks like you might also be self-muted. Okay, we can come back to Kathleen later if she still has a question. We have another question from Karen McFadden. Karen, your line has been unmuted and you can ask your question. And Karen, it also looks like you might be self-muted on your end. All right, we can come back to Karen later. And that is it for phone questions at the moment.
Okay, and just a reminder, if you do have a question, please either use the hand raising feature. We will unmute your line, but please also make sure that you, as Joy just mentioned, unmute your own line. And then you can also ask a question in the chat box, and we will try to either answer it via the chat or verbally as we have just a couple minutes left. I will give it one more minute just for any additional questions to come in. Okay, and then Katie, we were getting a question about target reviews. Somebody wants to know if you can submit a target review because the cost category was not reweighted. Somebody submitted for cost and quality exemptions, but cost was not calculated.
Okay, so the question, sorry, it's somewhere I can see it. Can you repeat it again? So they submitted a target review, or they are asking?
I believe they're asking if they can submit one.
So their cost performance category should have been reweighted to 0%, is what they're saying?
I believe so, yes. I can try to get more information.
Okay.
They submitted cost and quality, but cost was not calculated.
Okay. Yeah, if that does not look right, if they should have, for whatever, I'm not sure. Yeah, it's kind of like you need more details on the clinician, if they should or shouldn't be seeing anything for cost. But if they believe it should have been reweighted and wasn't, I would encourage them to either call our service center and see if somebody can look through it with them. They can look through their information with them and probably give them a better sense of if they need to submit a target review or not, or they can just go ahead and submit a form and then somebody from CMS will contact them.
Okay, thanks, Katie. We'll work to get more details on that. Joy, do we have any phone line questions?
Yep, we have one phone line question from Angelique Hamilton. Your line has been unmuted and you can ask your question. And Angelique, please make sure you're not self-muted on your end. Okay, we can come back to Angelique at a later time. And that is it for phone line questions at the moment.
Okay, and that's actually it for chat questions as well. We'll give it maybe one more minute to see if we have any other questions come in. Again, if you have a question, please use the hand raising feature or the chat box.
And it looks like we did have another phone line question come in. So Jason Shropshire, your line has been unmuted and you can ask your question.
Hi, can you hear me?
Yep, we can hear you.
Yes.
Hi, thanks for taking. I actually have two questions. So the first is regarding the news, I think that came from Katie Moore regarding the fact that you can submit another round of applications for EUC. Can you use that to trump a targeted review that you've already put in place, or how does that work?
Hey, Jason. So if you already have a targeted review I would, so they're going to need to edit the existing targeted review. So I believe in our targeted review, I'm trying to pull it up right now. I think there's information on how to contact them, but you need to edit the existing targeted review.
Okay, but you're saying within the existing targeted review, I can ask to have a category basically reweighted that I was having reviewed.
So, okay, now I'm understanding. So if you submitted, so I guess I'd need more information on your existing target review. If you've submitted data, so the EC application, even though it's through the target review form, it still can't override any data that was submitted in 2020. So I'm not sure if that helps.
That helps. Is there any expectation of when targeted reviews are going, there's going to be communication regarding an outcome?
Yeah, I know they approve and disapprove those on a rolling basis. So they don't wait until that deadline and then respond to all of them. Has anybody been in contact with you yet, or are you just waiting?
I'm just waiting.
Okay. I would, and I'm sorry, I'm trying to remember what information you have, if you have contact information to reach out to somebody or not.
I mean, my contact information should be in HARP. They should reach out.
No, I mean for you to reach out to them to let them know if to look at your existing target review to see if you could apply for this EUC.
So I think that's what I'm asking. I don't really understand. So I've received no notice of anyone requesting me request information, if that's what you mean.
Okay, gotcha. Yes, I would say best thing to do is probably to contact the service center and then let them know that you need to speak to somebody on the target review team about an existing target review, about possibly needing to edit it. And then they should be able to connect you with the right people, and then they can look at the existing target review and let you know if you qualify for that EUC.
Okay, thank you. And then other question is regarding eCQMs. So several of the numerators have numerator guidance sections, but when you look at the actual script of the measure, they're not written as a requirement for the measure. So is that just sort of a nice to have, or can someone comment on that?
Sure. This is Claudia from Mathematica. Um, Sometimes the narrative, the header section has additional guidance to help with implementation of the measure, and that isn't always able to be reflected directly in the eCQM logic. If there is a question about how to apply that or anything specific, please do ask a question on the eCQM JIRA tracker, and folks will respond to your individual questions.
Okay, thanks.
Hey, Jason, it's Katie Morgan. Can you send me an email with your contact information, and I'll see if I can talk to the target review folks and help out.
Sure. So I missed part of that. It kept saying muted, unmuted. So sorry. Can you say that again?
Sure. Sorry, it's Katie. I was just saying, can you send me an email with your contact information, and I'll see if I can have somebody look and see get you a status on your targeted review.
Sure. And what's your email address?
Yep, it's just Katie, KATI.moore@cms.hhs.gov.
Okay, great. Thank you.
Yeah, sure.
Okay, I believe that is it. Derek, I will pass it back to you as we are at time.
Okay. Thank you all for joining us today. CMS will share the slides and recording from today's forum in the coming weeks. In the meantime, if you have any specific questions, please email cmsqualityteam@ketchum.com. Next CMS Quality Program bi-monthly forum is tentatively scheduled for November, and CMS will share more information on the next forum when it becomes available. Have a good afternoon, everyone.